My name is Samantha Chao, and my new role this coming year is going to be as Director of Emergency Medicine Ethics. The role has not existed in our department before, and I don't think it exists anywhere else either. Clinical ethicists, their goal is really to help people navigate moral and ethical conflict. So anytime you aren't sure what the right thing to do is, you can often reach out to a clinical ethicist to try and help you navigate those situations. We encounter ethical conflict every single day. So imagine you have an elderly patient that gets brought in from home or from their nursing facility. You don't know anything about them. They're confused. They can't tell you what you would want. You're worried that they would need to be intubated. They have maybe code status paperwork, or maybe they don't have paperwork in their chart, and you look at them and you're not sure what to do next. And let's say you have a family member there that tells you, I want you to do everything possible for them. Trying to balance what you feel like is best for the patient and trying to honor their wishes or what you think their wishes are. And then on a more systems level, you can think about like scarce resource allocation. That is all ethics.
We have a lot of experiences in the emergency department where it's ethically and morally challenging, and having that resource there to come speak to us and debrief and get things off our chests is really beneficial.
I think that the ethics teams helps take off the moral burden from family members and the medical team, because there is such traumatic events that happen within the emergency room, and there are decisions that have to be made that you didn't think you'd have to be making that day.
Recently, we were able to have ethics help us with a situation where this patient unfortunately met their end of life, and the family was not yet ready to accept that we were at this stage of the diagnosis. The team was able to come and talk to them and the other physicians and really get the family on board with what that meant for the patient. It takes that stress and burden away from us. So it's just that extra resource that helps everyone in the emergency department, including the families, most importantly.
I think overall, I want to make everybody comfortable and confident to be a physician ethicist, nurse ethicist, to feel confident in navigating these things, and then to also become certified ethicists as well if they choose to be. It's also an interesting question to ask, like, where can ethics fit in systemically, departmentally, institutionally? And the answer is really everywhere.